everyone. I'm Dr. Vivekananda Hiremath, consultant urologist, andrologist, and renal transplant surgeon at Krishna Institute of Medical Sciences, KIMS Hospital, Mahadevapura, Bangalore. So, what is BPH? BPH is called a benign prostatic hyperplasia, where the prostate gets enlarged in elderly men due to age-related degenerative process, and it causes obstruction to the flow of urine. It's one of the very common conditions in elderly men, usually seen in men above 50 to 60 years of age. It's a non-cancerous condition. So, what are the common symptoms associated with this disorder? So, BPH is associated with difficulty in initiation of urine, frequency of urination, getting up frequently in the night to pass urine. There will be incomplete bladder emptying, or there will be very slow urination, or the symptoms left untreated can cause complications like blood in the urine, bladder stone, and also the kidney function can get affected, and also there might be complete stopping of the urine flow. So how common is BPH in India? BPH is one of the very common problem in elderly men in Indian population. It's common in around 50% of the patients above 50 to 60 years of age, and almost 80% of male population gets affected at the age of 70 to 80 years of age. And this BPH will have some of the financial burden on patients and its family members because of its treatment costs. So if we treat, or if we detect earlier stages and treat it, the cost and also the other issues associated with this can be prevented. How is the quality of life affected in patients with BPH? The quality of life is adversely affected in patients with BPH. Some of the common stressful events like difficulty in having sleep because of frequently getting up in the night, and patients will have difficult to cope up with their work-life balance because in work they have to get up frequently and pass the urine because of its, and also there might be some urgency which hamper their routine mental health and can lead to stress, anxiety, and also it affects their psychological health, and also the erection issues and all. It adversely affects their sexual health also. So in adversely, it overall it affects the person in and out altogether. And so we advise normally to detect it early if this patient has these symptoms, and go to a urologist and gets treated to prevent all these adverse effects and complications. Thank you.